Good morning, everyone. We'll discuss a short topic that is estrogen progesterone challenge test. Okay, estrogen progesterone challenge test. Where you should do it first is the indications. It is indicated in secondary amenorrhea. Second, it depends on the what is the basic pathology. Depends on estrogen primed, very important, the everything. This test will positive if it is estrogen primed. Okay, estrogen primed endometrium should be there, endometrium being present in the uterus. Okay, very important things. Then what is the procedures? I will tell the procedures stepwise manner. What you will do: patient with secondary amenorrhea, you will do a UPT. If it is negative, then you go for a progesterone challenge test. If it is negative, that means after giving tablet mifred for 7 days, if no bleeding, then you have to go for this estrogen plus progesterone challenge test. Okay, next what we'll do: what is the dose, what are the drugs? Okay, estrogen component is there and progesterone component is there. In the estrogen component, you have to give ethinyl estradiol. Okay, in the progesterone component, what is the dose? 0.02 milligram, or you can give conjugated equine estrogen, that is around dose is 1.25 mg. How you will give? See, the patient has to be taken daily for 25 days. Very important. This is the estrogen component. Then the progesterone component is medroxyprogesterone acetate. Okay, what is the dose? 10 mg daily from, you have to give, this is from day 1 to, this is the estrogen is from day 1 to day 1 to 25. Then the progesterone will start, this medroxyprogesterone 10 mg daily will start from day 15 to 25. Okay, or we have another options, because we know all OC pills, oral contraceptive pills, can be an alternative course to observe uterine bleedings occur or not. The next step is we have to see for uterine bleeding. If uterine bleeding is there, or if no bleedings. Okay, if no bleeding means, if no bleedings means, that means the local endometrial, the here what is happening, already I told, if you're giving a estrogen primed endometrium, estrogen already there, that is primed the endometrium, it it make the endometrium proliferative stage, make the endometrium newly prepare the endometrium for the progesterone actions. Progesterone will act as cement like actions. Okay, once the progesterone will give, it act as cement. Once you stop the progesterone, it will break down the cement. It will cause progesterone withdrawal bleeding, estrogen. Okay, so here, if it is there is no bleeding, that means there will be some local endometrial lesion present in the uterus. Okay, that what will it is suggest local uterine endometrial lesions you have to suspect. Okay, what are the diagnoses? It can be Asherman syndrome, intrauterine adhesions. Then what we will do next step, you can go for a HSG or hysterosalpingography or hysteroscopy. Okay, the next, if it is there is no bleeding, if it is bleeding is there, uterine bleeding is happening, uterine bleeding, that means the endometrium is already prime. Endometrium is responsive to estrogen. But here what happened, initially we are giving progesterone. Initially we are giving progesterone challenge test. At that time, after giving progesterone only, because there is less estrogen framed endometrium, so that with progesterone challenge test it is not bleed. When you are giving estrogen plus progesterone from outside, you are supplying the extra amount of estrogen to prime the endometrium. Now the endometrium is primed with the outside estrogen effect, so we have a decrease. What we will suspect from if bleeding is happening, endometrium is responsive, endometrium receptor is responsive, but the estrogen production endogenous estrogen production is inadequate. This is the problem is here. How the estrogen is produced? It is controlled by the hypothalamus, pituitary and ovarian axis. So you have to think about the HPO axis defect. The next step will be, we have to evaluate for hypogonadotropic hypogonadism, hypogonadotropic hypergonadism. So you have to do serum FSH, serum follicular stimulating hormone, serum luteinizing hormone, serum estradiol level. Okay, so very important. You can understand how this progesterone challenge is going on. Initially, estrogen progesterone challenge test, it is usually indicated in the secondary amenorrhea patients. We'll do in the secondary amenorrhea patients, secondary amenorrhea case. Okay, then it's depend on the estrogen. Very the concept is that it has to be estrogen primed endometrium being to be there to present in the uterus. First, in the secondary amenorrhea case, you will go for a UPT test. Any patients, you go for a first investigations is UPT, very important. Then if it is negative, you go for a progesterone challenge test. After giving after 10 days, 7 days, we provide for 2 weeks. If no bleedings, then you go for a estrogen progesterone challenge test. In the estrogen progesterone, there is two component. In the estrogen component, that is ethinyl estradiol 0.2 mg, or you can give a conjugated equine estrogens, that is for 1.25 mg. 1.25 mg day 15 to 25. Then in the progesterone component, you can give medroxyprogesterone acetate 10 mg daily day 15 to 25. Then you have to, or you can have options like high dose oral contraceptive pill. If it is no bleeding is happening, then there is some endometrium is not responding, there is some adhesions, local uterine pathology, so you suspect Asherman syndrome. Then your next step will be HSG or hysterosalpingography or hysteroscopy, diagnostic hysteroscopy, and you diagnose that part and manage also. In the, if uterine bleeding happening, endometrium is, that means endometrium responding, but there is inadequate endogenous production of estrogens, so you have to suspect the HPO axis defect. The next step will be the serum FSH, LH and estradiol level analysis.